COVID metrics in both North Carolina and Mecklenburg County declining even more. There was a spike in cases, you remember, after the holidays, but health leaders say that didn't reach the same heights as years past. Nationwide, the burden on the healthcare system is much less, too. It is prompting the president to announce a big shift in the country's response to the virus. In May, he will allow the federal government's public health emergencies to end. And WCNC Charlotte's Chloe Leshner is joining us live from Uptown to talk about some of the impacts of that decision. So the ending of these public health emergencies, what does this mean?
Hey, Vanessa. Well, the biggest change will really be to the cost of vaccines, tests, and treatments. Once these public health emergencies end, some people may have to pay for them out of pocket. And while COVID metrics are improving, health officials say we should not take this announcement from the president as a sign that we are out of the woods.
This upcoming May, more than 3 years after the COVID pandemic completely altered our society, the federal government's emergency declarations will end. That will shift who covers the cost of some of the tools we've grown to rely on.
Until now, most people have not had to pay for a test, have not had to pay for vaccines or the treatment, the medications like Paxlovid. What will happen after the public health emergency ends is that coverage will happen as it does for other things through health insurance.
It could create a problem for those who don't have health insurance. That's more than 1 million people in North Carolina and a cause for concern for some public health leaders.
We started to then think about, okay, who are the folks in our community who don't have healthcare insurance? What do they look like? And those individuals are the ones, of course, who are at greatest risk. And we know that disproportionately is represented by people who are already low income.
Nationwide, COVID metrics have been on a downward trend. The post-holiday spike was not as intense as the last 2 winters, and health experts believe COVID will likely fall into a seasonal pattern like the flu.
COVID-19 is not going to go away. That is still present in our communities. We will likely still continue to see, ups and downs and the waves that occur, particularly in respiratory virus season and winter months. And so still really important for us to keep in mind the tools that we have available to us to protect ourselves and our loved ones.
Health leaders say getting that most up-to-date booster will really help keep some of those surges at bay. Right now in North Carolina, only 21% of the eligible population has gotten that Omicron-specific shot. Live in Uptown, Chloe Leshner, WCNC Charlotte.
Chloe, thanks for those updates.